Hello, friends. The topic of today's discussion is about ectopic pregnancy, as to what are the reasons one has ectopic pregnancy, what should be done to prevent an ectopic pregnancy, and what are the things one should take care of once one has had one ectopic pregnancy. So, we get a lot of patients who've had a history of ectopic and are really panicked about it. So, we thought we'll make a video on ectopic pregnancy, break some myths which are related to it. So, the first thing is, so what is ectopic pregnancy? Any pregnancy, its usual location is in the uterus, and any pregnancy which is not located in the uterus and is located at any other place is called an ectopic pregnancy. That is, it is not in its normal position. And ectopic pregnancy is most commonly seen in the tubes, but these days, because of very high cesarean section rates, we see cesarean scar ectopic pregnancies also. Sometimes we see cornual pregnancies also. That is a pregnancy which is in the uterus, but it is very close to the tube. And very, very rarely we see abdominal or even ovarian ectopic pregnancy. So we will be sticking our discussion to tubal ectopics because they are the most common. So how can we prevent an ectopic? So patients who have a high likelihood of ectopic pregnancy are the ones who've had previous episodes of pelvic infections and who've had previous episodes of abdominal surgeries. So the first thing is that any abdominal surgery, one should prefer that it should be done laparoscopically and not by an open surgery. So any surgery in the abdomen which is done by an open method, patients will have higher chance of having ectopic pregnancy. Any laparoscopic surgery will reduce the chances because abdominal open surgeries have a higher chances of instilling infection into the abdomen compared to the laparoscopic surgery. If one has symptoms of having any pelvic infection, one should see a doctor and get oneself treated fast. So why does ectopic happen? So the embryos are not fixed in one place. The embryos keep moving, and as we know that the embryos are formed in the tube. So the tube picks up the egg and the sperm goes into the tube and fertilization happens in the tube, and a usual embryo comes from the tube into the uterus. But if the embryo does not find a good place in the uterus to implant, or if it has grown too big in size and the tube obstructs its way, there are adhesions in the tube and the tube does not let the embryo come out of the tube into the uterus and it gets trapped inside the tube, it will implant there only. And once it starts increasing in size, it gets a lot of vascularity from everywhere, and the tube does not have enough space or distensibility and it ruptures. How to prevention? We said that to prevent an ectopic pregnancy, one can avoid an open surgery and one can treat pelvic infections. And some of the ectopic pregnancies might be without any reason, but the known reasons can be taken care of. And how to early diagnose ectopic pregnancy? So early diagnosis of ectopic pregnancy is that once a lady has missed her periods, that is, if one has regular cycles, the periods will come on a particular date. And once the lady has missed her periods, let us say 7 days to 15 days of missed period, one should go for a scan and localize the pregnancy as to where the pregnancy is located. If the pregnancy is located in the uterus, then it is fine. Then ectopic pregnancy will not be missed. So an early scan is something that we advise to all our patients. Even if in general population 1 or 2% of patients will only land up with an ectopic pregnancy, all 100% of patients, if they do a viability scan or a localization scan, they can avoid an ectopic pregnancy. Then we see patients who've had a ruptured ectopic pregnancy before. They come to us for consultation and they're worried that the next pregnancy might be ectopic pregnancy. What are our advices? So the first preventive measure again in ectopic pregnancy is, if it is diagnosed early, it can be managed with medical treatment. So there are a lot of injections that are available wherein the ectopic pregnancy can be managed with medicine and surgery is not needed. The first thing is avoid surgery. Second thing is, if surgery is imminent or it has to be done, then the surgery should be done best by a laparoscopic route. That will be done only if the ectopic pregnancy has not ruptured, or if the patient is in a fit condition to do it laparoscopically. These days, because of advancement in medical facilities, even ruptured ectopics are managed very well laparoscopically. So if one has to opt for a surgery, laparoscopic surgery should be preferred over an open one. So that will help the patients in not developing ectopic pregnancy on the other side. So once a patient has had one episode of ectopic pregnancy, she has a very high chance of having ectopic pregnancy again. So they have to be more vigilant because they might have 10% chances. After 2 ectopic, the chances increase to 20% and so on. So if one has 1 episode of ectopic pregnancy, the chances are higher. So one should obviously be more vigilant and ectopic minded and do a scan earlier on missing a period. So if a patient does not conceive after having 1 surgery of ectopic pregnancy, then we always tell them to look for the other tube, if the other tube is patent or not. So 6 month time is given. Let us say, for example, if a patient has 1 ectopic pregnancy which got ruptured and she operated it and now she's again trying for pregnancy, then 6 months time is given for her to try naturally and to try for pregnancy. And if no pregnancy has happened, or if ectopic pregnancy has also not happened, or no other pregnancy has happened, then that means the other tube is not working. So after 6 months of surgery, one should go and see a fertility consultant to look for the other tube, and if the other tube is not working, then IVF is the answer. What IVF will do is that it will do the function of the tube outside and fertilize the eggs and develop them into embryos, and the embryos will be put back into the uterus, and there will be a lesser chance of having ectopic pregnancy by doing an IVF. So what we are seeing is that patients have 1 episode of ectopic pregnancy and then they have 1 surgery, and then after that they do not conceive and they do not see a doctor, and the lady's age keeps advancing, and then they come after a very large duration of time which has been spent in waiting for natural pregnancy to happen, and in that case the chances of having pregnancy with IVF keeps on reducing as the age advances. So as the age advances, the AMH falls, and the patients who could have got pregnant by IVF, their chances of getting pregnant would reduce if large amount of time has passed and they did not do it. What are the indications for laparoscopic surgery and what are the indications for open surgery? Usually there are no indications for open surgery in case of ectopic pregnancy. Ectopic pregnancy should be managed with the help of a laparoscopic surgery. If laparoscopic surgery has to be done, it should be done in the hands of a specialist. And finally, in order to revise this video, ectopic pregnancy can be prevented by avoiding open surgeries or by diagnosing it in time and taking treatment for pelvic infections. A diagnosis in time will help in medical management and will avoid a surgery. And if one has had 1 episode of ectopic pregnancy, there is a very high chance of having ectopic pregnancy on the other side. That should be diagnosed earlier. And if one is not able to conceive, even after 6 months have passed from the surgery, then one should see a fertility consultant and get oneself counseled for an IVF procedure. And if you have any questions on this topic, you can leave us a comment. We will be happy to reply. Thank you very much.